Hello guys, welcome back to my channel. It's been a really long time. I was doing reproductive and I realized there are not really any videos on Birds and Beyond pertaining to reproductive anatomy. So I'm going to make one. This one's about the ligaments, okay, in the female reproductive tract. So let's get into it. Before I go into the ligaments, like to tell you about how the uterus actually looks like in a female's body. Of course, you've probably seen this picture. The two angles at which the uterus is situated at. This is not really important, just for your visualization sake, that this is how the uterus is. On top of the bladder, here you probably will have your rectum. That's all. So first, before we go into the ligaments, I want to talk about the blood supply also. So I want you to just notice on the position of the arteries. We have the ovarian artery here, okay, and the uterine artery here, okay. These are the two main arteries, okay. The other areas, they don't really have their own supply. They get collaterals from the ovarian artery and from the uterine artery, okay. Other areas in the sense, all this part and the fallopian tubes, okay. Now we get into the ligaments. First we're going to talk about the suspensory ligament of ovary and the ligament of ovary. So starting with the suspensory ligament of the ovary, it is also called as the infundibulopelvic ligament because it's also kind of connecting the infundibulum to the pelvic wall, but technically it is connecting the ovary to the pelvic wall. So that's why we call it the suspensory ligament of the ovary. The only important point about this is it contains the ovarian artery, okay. That's why I showed you this picture first. So the ovarian artery is contained in the infundibulopelvic ligament. Uterine artery is also contained somewhere, that we'll come to later. Now talking about the ligament of the ovary, very simple. It's connecting the ovary, you could say, to the uterus, to the uterine horn more specifically. That's all basically, nothing much. Only thing is, it's kind of like a content of the broad ligament. The broad ligament will come somewhere like here. So all of these things are actually contents of broad ligament, okay. So before we move ahead, I'd like to just show you this quickly. Not important, you can completely skip this part, but it's just interesting. So in a nullipara female did not give birth to any child, the ovary is kind of vertical, okay, suspended like that. But when the female has had multiple pregnancies, because of the pregnant uterus, there is a lot of pull to the ovary like that. So eventually in a multipara female, the ovary becomes horizontal. So I just wanted to add that because it's fun. Now we move on. So we are done with infundibulopelvic and we're done with ovarian ligament. Now coming to the round ligament. Okay, so where is the picture? Here it is. So this is your round ligament. It's kind of incorrect in this picture. If I had to correct it a little bit, it goes like that, okay. It does not connect to the pelvic bone. It connects the uterus to labia majora, kind of in front of the pelvic bone. Understood? There's another ligament called the pubocervical ligament, which connects pubic bone and cervix. Not important, but that will make more sense coming here. Whereas the round ligament, it is connecting uterus to the labia majora, okay. So I'll rub this off. So this is kind of acting like traction against these two ligaments. There are two round ligaments, right? What are these? The uterus sacral ligaments, okay. I'll come to those. So the round ligament connects uterus to the labia majora. Now one thing I need you to understand is that this is how it looks from a different view, from the, you could say, top view, okay. It's kind of posterior, like ligament of ovary is kind of like with the ovary, so it's posterior to that, and it's related to the inferior epigastric artery, okay. For now, remember this. I'll come back to this at the end. That's all for round ligament. Now uterosacral ligament. So for that I'll show you this picture. So this is the transverse section of the human body, female body. We have the uterosacral ligaments like this. So as I said, they are keeping or pulling the uterus from the back, and from the front you have the round ligament and you have the pubocervical ligament also that I showed you in this picture. Round ligament and pubocervical ligament. And then at the side we have the transverse cervical ligament, which is also called as the transverse cervical ligament of Mackenroth, or if we go according to the first stage, it's called as a cardinal ligament. Okay, so cardinal ligament is kind of like the condensation of the end of the broad ligament. The broad ligament kind of continues as the transverse cervical ligament. It's the same. It's like a continuation. That's all I can say. A condensation or continuation. You can see that here. And now we realize what the transverse cervical ligament is the one which includes the uterine artery, right? The uterine artery, because it lies around here. So the transverse cervical ligament, it is connecting this, you could say, cervix to the lateral wall, abdominal wall, and it contains the uterine artery. Okay, so that was about the transverse cervical ligament. Lastly, we talk about the broad ligament. The broad ligament is all over the place. It just has a lot of contents. Everything here: the ovary, the ligament of ovary, suspensory ligament of the ovary, uterine tube, uterine artery, ovarian artery. Anything you can think of in this area is included in the broad ligament. Okay, it is connecting uterus to the lateral pelvic wall. All of these are there. Okay, yeah, this is important, which is pretty easy to remember. 3 parts are there. This area will be called as mesosalpinx because it's related to the fallopian tube. This area will be called as mesometrium, related to the endometrium. This area will be called as the mesoovarium. Okay, nothing much. So that is about the ligaments. Now I want you to focus on this diagram. You see the uterus is on top of the bladder, that we understood by the first picture itself. And now we see how the ureter is placed. Okay, now in this picture all these structures look very far apart, but actually in the human body they are very clumped up, obviously. So if you're trying to ligate any of the structures here, the ureter will obviously get affected, right? So which structures will you ligate? Obviously in tubal ligation you will ligate the uterine tube, but the fallopian tube is big enough you can't really mistake it and you can't really damage ureter during that. Apart from that, in other surgical procedures, we ligate ovarian artery during oophorectomy and uterine artery during hysterectomy. Okay, so ovarian artery is somewhere here and uterine artery is somewhere here. Both of them are very close to the ureter. So when we are trying to ligate them, either in the transverse cervical ligament or in the infundibulopelvic ligament, there is risk of injuring the ureter. Okay, more so in the uterine artery, because if you see in this diagram, this is the uterine artery, this is the ureter. They are very in the closest of proximity. So that point I had to tell you. So I think we done with pretty much all the points. This is just for your understanding, not really important, just to see how it actually works out. The broad ligament actually has 2 layers again, which is not important. So it's basically including everything. I told: ligament of ovary, it's including the round ligament of uterus, it's including the uterine artery. This is the broad ligament. So if we see the uterus laterally, right, this probably we are seeing uterus laterally. So aage it is covering, piche se it's covering the broad ligament, and everything in between is acting like the contents. Okay, and yeah, they are showing you how from where the ligament of ovary comes, from where the round ligament comes, just for your understanding, not really that important. Okay, so we're pretty much done with all the points. Okay, infundibulum ligament connects this, has ovarian vessels, ureter ka risk hai. Ovarian ligament, ovary to uterine artery, I'll come to this. Round ligament, labia majora, travels to the, I'll come to this also. Broad ligament, again, this is done, this is done, this is done. Cardinal ligament, uterine vessels are there, condensation at the base of the broad ligament, and uterine vessel ligation damaging the ureter, and uterosacral cervix to sacrum. Now I'm talking about this part. Now that I have 2 pictures to make that clear too. Now what is the gubernaculum? not really important when you're talking about female anatomy, but in male anatomy, gubernaculum is what connects the testis to the bottom of the scrotum. Okay, it's a mesenchymal tissue. Now, this ovarian ligament is a derivative of gubernaculum. Why are you saying that? Because the ovarian ligament is also connecting the ovary to the uterus only, right? And this is also connecting the testis to the scrotum. So there is some similarities. So that's how you can remember that ovarian ligament is a derivative of gubernaculum. Similarly, round ligament is also a derivative of gubernaculum. Now, I literally can't help you remember that. You just have to remember that. The last thing is yay point. So now, as I said, the round ligament of uterus is related to the inferior epigastric artery. In males, the spermatic cord is related to the inferior epigastric artery. So you could say that round ligament and spermatic cord are kind of like analogs to each other. In males, the spermatic cord is the main content of the inguinal canal, and then more stuff is there inside the spermatic cord. Whereas in females, round ligament is what is the content of the inguinal canal. So that's how you remember travels through inguinal canal. So yeah, that was pretty much it. I hope you found this video useful. I'll see you in the next one. Bye.